Wow, that's amazing.
Yeah. The faculty know this.
Some subspecialties, over half the positions are not filled. Some fields, we're not even training the number of subspecialists to replace those who are retiring. That's concerning to the point of alarming.
We have to be concerned about the trends. I think we have to modify some of the behaviors, and we also have to make sure that we have to listen to why people aren't going into pediatrics.
To be quite honest, part of the problem is the way we finance medical education and healthcare in this country. There are subspecialties where there is the potential to generate a lot of revenue from patient care and procedures. And there are others that aren't, but all of them should be in like and in kind. They all contribute to the system, and we should be able to understand that we may have to support them in different ways to achieve a good endpoint.
I think continuing to think about how can we help junior investigators get the first R01 or the equivalent, how can we continue to support them, find additional funding, and not just make it, it has to be an NIH, it has to be a federal grant, that there's other ways out there that they can gain experience.
Data are empowering, so that, it's kind of like what my kids used to say, focus on the donut and not on the hole. What is the donut? The donut are the data that we have to say why there's a problem. And then we figure out, based on that data, how we can make, if it's a financial issue, if they find that going into pediatric ID, which is not highly compensated, at least in surveys, and not enough people are doing it, then we have to figure out how we can increase that compensation. So again, we have to figure out what the problem is, and we have to solve it.
The Children's Hospital of Pittsburgh is located in the neighborhood of Lawrenceville. There's a middle school called Arsenal Middle School that is about 6 blocks from our hospital. We've just started an engagement with the Arsenal Middle School leadership to adopt that middle school, where our faculty in pediatrics, our fellows and residents, will spend time at Arsenal helping to teach science, but also health and some other courses we've talked about, because we think that group is an incredibly impressionable group that we could engender some excitement about our career, hoping that some of them will attract to careers in medicine and science, and hoping that they'll want to stay in Pittsburgh.
And the second category was the metabolic or endocrine causes.
I would say equalize the playing field. Value people for what they contribute in a broad sense to children's health and to our hospitals and to our clinics and to our other services. Value them for what they truly bring to the table. I really think that's what it comes down to, because it can't possibly be that it's not interesting.
We in academic pediatrics are part of the solution, and we have to be out there telling our stories about how we are excited about what we do and how it makes an impact.